Thanks for joining me. My name is Sean and I'm a registered dietitian. Today we are going to be reviewing protein needs. So if you've seen any of my other videos on nutrition support, I often give you the calorie and the protein needs for patients. However, today I'm going to go over exactly how I figure out what the protein needs might be for a patient. And I will say, before we dive into this is often a highly contested topic, especially if you look at people who are into bodybuilding or sports nutrition. They'll often claim that we need excessive amounts of protein, often as high as 1 gram per pound, which would be 2.2 grams per kilogram, which is really an excessive amount. But with that aside, this is looking at different recommendations by actual studies that look at the nutrition needs of patients with these conditions. So this is really aimed at hospital patient protein needs. This isn't aimed at fitness, and you could ask a lot of different experts and get a lot of different answers, but this is what I use as a clinical dietitian, so hopefully you find some value in it. So one of the things that we need to look at when we're working with patients in general, as well as nutrition support, is the calorie, protein, and fluid needs of our patients. Now, specifically looking at protein, here, if we just have a non-hospitalized patient, they need something like 0.8 to 1 gram per kilogram. So remember, there's 2.2 pounds per kilogram. So this would be like for a 75-pound male, which is 155 pounds approximately, would come out to around 75 grams on the upper end, and I don't know, closer to 60 grams on the lower end. For our hospital patient, I'm typically not going to go below a 1 gram per kilogram, and that would be for someone with pneumonia, or they don't need surgery, they don't have trauma, they don't have wounds, they're not malnourished, they're coming in with like the cold or something like that. But typically, the most often one I'll use is 1.2 grams per kilogram. You can never go wrong with going with 1.2 grams per kilogram. It works for hospital patients, it works for slightly undernourished patients, it works for mild surgical patients, so it's really a very useful number to use. So if you're not entirely sure, start with at least 1.2. Now, if you have a surgical patient, if they have GI surgery or something like that, 1.3 to 1.5 grams per kilogram. Now, why the difference? Well, it depends. Did they have laparoscopic surgery or did they have open surgery? Is their abdomen still open and they plan on going back to the OR for closure? Do they have a wound vac? So if they have a wound vac, I'm going to do 1.5. I never go lower than 1.5 from a patient with wound vacs. It also depends too, like did they have their toe cut off or did they have a BKA, below the knee amputation? So that's where the spread comes in. So your more mild surgeries versus your more intense surgeries. Now, what's not on here, but if you do have burn patients or something like that, I'm not a burn dietitian expert, but you're looking at 2 to 2.5 grams. So, you know, and they have a lot of surgeries and skin grafts and things like that. So you're going to go much higher than this 1.5. So there are surgical examples of patients that need more than 1.5, but generally speaking, 1.3 to 1.5. Now you're also going to have your renal patients. This is people with end-stage renal disease. We're not talking about nephrotic syndrome. We're not talking about acute kidney injury. We're talking about end-stage renal disease on dialysis. So if they're a hemodialysis patient, I'll use something like a 1.2 to 1.5. For your peritoneal dialysis, you can go up as high as 1.8. And that's because with peritoneal dialysis, you do lose a little bit more protein than you do with hemodialysis. So keep that in mind if you have end-stage renal patients, especially those that might be intubated. They're going to need some more protein. Pressure ulcers. This is one of the things that we'll see a lot. So a pressure ulcer is an area on the body where there's tissue breakdown based on prolonged pressure on a specific bony prominence. Now, you can get pressure ulcers on, let's say, your buttocks, but a lot of times you're going to see pressure ulcers like on your ischial tuberosities or on your heels or on your shoulder blades or on the back of your head. So any of these body points where when you're laying down there's excess pressure on those points, that's typically where we're going to see pressure ulcers. And that's why in the hospital you'll see a lot of protocols that are, turn patient Q 2 hours. So every 2 hours a nurse or the CNA is in there turning the patient, keeping pressure off those spots. You'll also see specific waffle mattresses or boots that are helped to elevate those spots and keep them from developing pressure ulcers. This is a really big thing. And so for your stage 1 pressure ulcer, I'll put a picture here on the screen, but your stage 1 pressure ulcers do not have a breakdown in the skin barrier. So the skin is intact, but there is some sort of superficial wound there, 1.2 grams per kilogram. For your stage 2 here, we've broken down the skin, but we haven't gone through that fat layer yet, 1.2 to 1.4 grams per kilogram. For our stage 3, now we're starting to move through that fat tissue. So we've gone through the skin, the dermis, the epidermis, we've gone through the muscle, and now, I apologize, we've gone through the fat. We haven't gotten to the muscle yet, but we've gone through the fat, 1.5 grams per kilogram. Now with these stage 3s to stage 4, this means multiple stage 3s, large stage 3s, or stage 4. So now we're getting down into bony tissue. So we've gone through the muscle, we've gone through the fat, and now we're down towards bony tissue. So 1.5 to 2 grams per kilogram. Now, as I mentioned earlier in the video, most of these, or I should say all of these, are kilogram ideal body weight. So we're not using actual body weight, because if you have a malnourished patient that comes in that's 35 kilos, you're going to underestimate their protein needs. Likewise, if you have someone that comes in that's 150 kilos, you might overestimate their protein needs. So ideal body weight for men is 106 pounds for the first 5 feet, plus 6 pounds for every inch after 5 feet. So if you have a 5'10" male, that'll be 166 pounds. And then you can divide by 2.2 to get your kilograms. For women, it's a little bit less. It's 100 pounds for the first 5 feet, and then 5 pounds for every inch above 5 feet. Now, if you have a woman that's below 5 feet, I will subtract 3 pounds, and then of course converting to kilograms. So there's also deep tissue injuries or unstageable ulcers. That's where the skin is intact, but there's tissue breakdown, often necrotic tissue breakdown of the fat and then the muscle layers. And so with those, you don't, until that sort of caves in and that top tissue breaks open and you can see just how extensive that wound is, these are actually the worst. You're looking at least your 1.5 to 2 grams per kilogram, because those often have are more extensive than what's easily detectable just based on appearance. So I hope you found some help with these protein recommendations. Again, this is a general guideline. This isn't exact for every patient. You're going to want to look at your nutrition support or your other dietary manuals that you have on site for specific references, or consult a dietitian on staff for your more complex patients. But this will help get you started. If you have any questions, please post them down below. If you find these videos helpful, feel free to subscribe. It gives me motivation to stay late at work and make them for you. So I hope that you find some value in these videos. Thanks for watching. Cheers.